Hello, class. Today, my topic is about mental health. I want to bring awareness to the topic of mental health because there has been a real decline in our world lately. When it comes to mental illnesses, they are affecting our closest friends, our relatives, our coworkers. You individually may be struggling. Awareness needs to be spread because without care, mental illnesses may lead to drug addiction, poor physical health, and personal relationships. Fortunately, there are healthy coping mechanisms such as exercise, a healthy diet, and good socialization. First, kids are turning to drugs as an escape, which is a very dangerous route to go to. Lozano Alyssa stated the following in her article about behaviors in adolescents. She said that drug use, such as marijuana, opioid, risky alcohol, and cigarette use, are more prevalent among adolescents who reported a past year major depressive episode than adolescents without a major depressive episode in the past year. There has also been an increase in nicotine usage among teenagers. The article Addictive Drugs, the Cigarette Experience states the following. Users of most drugs, including prescription and over-the-counter drugs, have a good idea of the effect they're seeking, which is always some kind of high or euphoria of some kind. As you can see, these kids are looking for happiness because of their bad mental state, and they're looking in places that are dangerous. Personally, I know many of my friends that use these substances also struggle with depression or panic disorders, anxiety, ADHD. There is definitely a correlation. Next, poor physical health. Mental illnesses are often linked to disordered eating, insomnia, and self-harm, and others like these. Insomnia is very common in people with high stress levels and/or anxiety and depression. The article from the Journal of Eating Disorders states that the mental health problems such as depression, anxiety, suicidal attempts are found to be way more prevalent among people suffering from eating disorders. Eating disorders has been a popular, new, very common illness among girls and guys because of impossible beauty standards, body standards that these kids want to reach up to. An article published in 2004 by the Practice Nurse states that there has been an disturbing increase in the number of young people calling the Children's Helpline because they are self-harming, which was an increase of nearly 30% from the previous year. This being 19 years ago, we can only imagine the more acute this has gotten. Next, it's affecting relationships. People dealing with depression are more likely to isolate themselves, and this is hurting their relationships with their friends, their family, their romantic relationships. And fortunately, there are ways to cope. The BMC Psychiatry conducted a test on young people, and they noted that a lack of understanding from others, from their partners, family, and peers, and unreliable or absent support systems resulted in increased feelings of loneliness and social isolation. This generation is more known for their feelings of loneliness. Next, for ways to cope, moving on, exercise releases endorphins, which is a positive chemical in our brain, as well as eating the correct foods will ensure our body is getting the correct nutrients and it's fueling your brain, as well as supplement vitamins and minerals are vital for us. The British Journal of Sports Medicine conducted a short-term test on patients with a major depressive episode, and for just 10 days, they followed a workout regimen of just 30 minutes on the treadmill. Their scores of depression went from 19.5 to 13, which is a huge difference. Thank you for your time and for listening. Lastly, I just wanted to say that the decline in mental health is real and it cannot be a topic thrown under the rug any longer. I know especially in Hispanic communities, it can be very brushed off, but it's going to play a huge role in our quality of life and our future. They are having mortal results if not cared for properly, so we need to really strive to take care of our mental health. Thank you for listening.